To ensure the easiest process in purchasing your Quadriciser, we have sent you this video detailing the unpacking and setup of the Quadriciser and a purchasing kit outlining the purchasing process. Once you decide to purchase your Quadriciser, you may want to choose to pay cash either by wiring the funds to the Quadriciser account or by using a cashier's check. If you elect to wire the funds, please adhere to the wiring instructions in your purchasing kit. If you elect to purchase with a cashier's check, please send it through a certified carrier such as UPS or FedEx. Next, you will want to view this video in its entirety and sign the enclosed DVD disclaimer form. This form simply states that you have viewed the video and that you understand the Quadriciser's functionality. Next, fill out the measurement sheets. There's both a hand measurement and a body measurement. The hand measurement ensures the proper sizing of the gloves. It is best to do an outline of the right hand and the left hand. If you do not need the gloves, please let us know. The body measurements ensure that the Quadriciser is sized to your specifications when you receive your unit. When your purchasing paperwork has been completed, it can be emailed, faxed, or mailed, whichever is the most convenient for you. We must receive payments and all signed documents before the Quadriciser can ship. Once you have received your Quadriciser, please remove the packing list from the outside packing list pouch on the box. Pull the packing list out of the self-addressed stamped envelope and sign it. This signifies that you have received your shipment in good working order and that we can now register your warranty. Once signed, use the self-addressed envelope and send it back to Quadriciser. Your warranty will begin as soon as we receive your signed packing list in the mail. How to unpack your new Quadriciser. The Quadriciser comes to you almost completely assembled. It is customized to the measurements you send us from your purchasing kit. It is then prepared for shipment. Our contracted freight company will deliver the Quadriciser to your address. Please note, all Quadricisers are shipped via truck lines and drivers are only authorized to deliver to the residence and not inside. They are freight line employees and not Quadriciser employees. Once unloaded, your crate will look similar to this. If your crate is damaged or does not look like this, do not accept the shipment. You will need to cut the strapping, remove the box top and set it aside, lift the top off the skid and set it aside. The base is secured to the pallet. Cut all the ties on all four corners of the base. Cut loose the top back bars. Pull them loose from the package and set them out of the way. The remaining top bars are secured to the machine. Do not cut those loose until the machine is in its proper place. Take the headrest and insert it into the two holes in the back of the seat. Lift the accessory bag over the headrest. Lift from the back of the machine and roll the Quadriciser off the pallet and into your home. The Quadriciser will fit through doors as small as 32 inches wide as long as the doors can open completely. Position the Quadriciser where you want it. You will need to be close to a grounded plug. Now remove the ties holding the other top bars. Inside of your Quadriciser accessory bag, you will find the tools needed for adjusting the Quadriciser. Take the back bars that you set aside earlier and align them on the back of the machine. Match the letter to the corresponding letter and align the bolts with the holes. Tighten using the smallest Allen wrench from your toolkit in your accessory bag. Next, unclip the hand grips from the seat belt. Lie the hand grips with the ropes attached on the floor. Take the two front bars and slide them into the two holes on the motor housing. Be sure to notice that the corresponding letters match up. Top slide bars will be on the correct side for their installation. Slide the bar onto the top. Repeat for the other side. Tighten the knobs on the front and the back of the top slide bars. Pretty easy. You are ready to plug in your Quadriciser and get started. Making adjustments to your Quadriciser. The Quadriciser is completely adjustable. The headrest, the seat, and the motor housing all adjust for the best possible fit for you. As mentioned earlier, the Quadriciser comes to you set at the measurements that you provided. But if adjustments are needed, here's how to do just that. The headrest can be raised or lowered, or tilted forward or backward for your comfort. The seat's armrest can also be raised or lowered for your comfort. The armrest also has 3 positions, all the way up, to the center, and all the way down. The seat has 2 seat belts, a chest strap for those who need more upper body stability, and a lap belt to ensure that the hips stay in the proper alignment throughout the exercise. You may not need the chest strap, but be sure to always wear the lap belt. Underneath the seat to the left side is a pull for adjusting the seat both forward and backward. You may want to slide the seat backwards in order to get into the Quadriciser more comfortably, then slide it forward to the most comfortable position during your workout. See the proper seating position in the manual. On the left side of the seat back, there is a lever adjustment. The lever will angle the seat to any position. You can either sit in an upright position or you can recline completely. Be sure that the lever is completely depressed when making these adjustments so as not to strip the mechanism. You can also adjust the seat height. Underneath the seat, there is a stabilizer knob and a set screw. Loosen the set screw, then pull the stabilizer knob to adjust the seat either higher or lower. The motor housing is raised in much the same fashion as the seat. Loosen the set screw, then pull the stabilizer knob to either raise or lower the motor housing. Note, when making these adjustments, you will need to loosen the knobs on the upper bars to prevent misalignment of the slide bars or jamming. Rear extension bars. These extension bars rotate outward to create a multi-adjustable attachment point for the tension cords or for the pulley nearest the hand grip as a variation on the D2 extension pattern. As you see here, the patient's hand or wrist is not in proper alignment. Using the tension cords and the extension bars, we can correct the hand and wrist alignment. To utilize these extension bars, you will first need to loosen the knob on the back bar. You will then rotate the bar around from the back of the machine to the desired position along the side and retighten the knob. By attaching 3 tension cords, we can correct the hand-wrist alignment. Attach one end of an 18-inch tension cord to the hand grip and the other end to the stainless steel bar on the motor housing. Attach one end of an 18-inch tension cord to the hand grip and the other to the upper back slide. Attach one end of a 26-inch tension cord to the hand grip and the other to the slide on the extension bar. The extension bars can then be adjusted further if needed. If you have a youth model, you can use this same setup, only the tension cords will vary. Before starting your Quadriciser, the user's legs should be resting in the leg cradles and the hand grip should be held. This will prevent the hand grip cables from becoming entangled, which could cause personal injury or damage to the machine. If your machine has the pulse oximeter, you may want to clip the earpiece onto the user and turn on the oximeter to obtain a reading before exercise begins. You may take readings throughout the duration of the session, but be sure the clip is secure and the cord is not being unnecessarily jostled. To obtain the most accurate readings, bring the machine to a complete stop for a few moments before resuming exercise again. Data readings can be downloaded to a computer via USB or Bluetooth. See the oximeter instruction manual on the CD that accompanies your Quadriciser. You will find it in the back of your Quadriciser instruction manual. Your pulse oximeter charges via USB and comes with a partial charge. The oximeter and its accessories come packaged in a small box within the Quadriciser shipment. Rotate the speed knob control counterclockwise to the 0 position. This will allow the user to gradually increase the speed of the machine. Caution: failure to set the speed control to 0 could cause a sudden jerking motion to the user. Rotate the timer knob clockwise to the desired session duration. The available durations are from 0 to 30 minutes. The Quadriciser will automatically stop when your session has expired. The timer can be adjusted to extend your session. If you choose, you may stop the session by pressing the forward stop reverse switch to the stop position. The timer will continue to click until the time is up. This is perfectly normal. On the forward stop reverse switch, select the motion that you prefer, either forward or reverse. Do not reverse the motor direction without pausing to the stop position first. Now gradually rotate your speed knob to your desired speed. Hand and height adjustment using the cord tensioner. Place your fingers and thumb on the tensioner as shown. This will help maintain stability. Take the top pole in your opposite hand and pull it towards you. The patient's hand should begin to move up. Gently pull the top cord towards you. This will tighten and raise the hand a little at a time. Once released, the tensioner should lock into position. To release the tension cord, hold the tensioner as described in Figure 1 and slide the button on the tensioner toward you in the unlock position while pulling the cord up and away from you. Raise the hand as high as you desire. Note, release tension when the hand is at its lowest position. If there is still too much tension to release the cord, stop the machine and remove the hand from the hand grip. When making adjustments to the hand height, remember to make adjustments slowly, maybe only an inch at a time, to prevent injury or discomfort. Grip Assist gloves. Use the Grip Assist glove for someone whose hands are contracted or for someone who does not have the ability to hold on to the grip. The easiest way to put on the Grip Assist glove is to begin by removing the hand grip. Next, set the hand grip in the lap of the user. Open the glove. The gloves are marked R for right and L for left. Next, insert the hand, making sure that the thumb is outside of the glove. Secure around the wrist, making sure that the Velcro does not touch the skin. Carefully work the contracted fingers open, folding the hand over the Grip Assist insert. Hook the insert onto the hand grip. Pull the glove through the hand grip and then Velcro onto the wrist in place, again making sure that the Velcro does not come in direct contact with the skin. Note the position of the thumb as it is on the opposite side of the grip from the palm. Finish by reclipping the hand grip with the gloved hand, making sure that the thumb faces the rear of the machine. Warning: these gloves are not to be used unless someone is present to assist you during your entire exercise session. The Quadriciser is also available in a wheelchair model and a youth model. The wheelchair model is available for those unable to transfer to the seated model. The wheelchair can easily be rolled onto the base, but be sure that the wheelchair is centered and locked into place. Adjust the wheelchair so that there is ample distance between the crankshaft and the operator's knee, to ensure that the knee does not come into contact with the crankshaft during its rotation. Please note, not all wheelchairs will work with this model. Wheelchairs where the footrest does not detach or swing out of the way prohibit the rotation of the Quadriciser's foot cradles. For that reason, we recommend a live trial demonstration to see if your wheelchair will work before purchase. The youth model is essentially the same as our adult model, but with a smaller foot cradle and child seat with a 5-point harness instead of a seat belt. The youth model does not recline. Your accessory bag. In the front pocket of your accessory bag, you will find your instruction manual. Please read through the instruction manual and keep it handy. It is a vital tool for a proper use of your Quadriciser. It will guide you through all of our safety instructions, through the many exercises. The manual also shows you how to utilize many of the accessories you can order with your Quadriciser. The gate wedge ensures proper leg and hip alignment. This is helpful for leg control and for scissoring. Trapeze hand grips allow the use of tension cords to obtain proper alignment of the hands. Tension cords are utilized to obtain proper alignment of the hands and arms or for added resistance. Grip Assist gloves come in a wide range of sizes for those unable to hold on to the hand grips. Soft foot wedges are utilized to increase the dorsal flexion or to obtain proper foot alignment. All of these accessories fit nicely into the Quadriciser accessory bag, which you can hang from the back of your headrest to keep everything close at hand. Your Quadriciser comes with a standard 1-year warranty. The warranty includes telephone support provided by a certified Quadriciser technician, labor and parts on all repairs done here at our facility by a Quadriciser certified technician. Exclusions are normal wear and tear and freight charges. We also offer an extended warranty program that offers all of the same benefits as your standard warranty. To take advantage of this opportunity, you must call before your original plan expires. Our extended warranty options are A. For an additional year warranty, $1,200. B. For an additional 2-year warranty, $2,000. C. For an additional 3-year warranty, $2,700. D. For an additional 4-year warranty, $3,200. E. For an additional 5-year warranty, $3,500. If you are interested in an extended warranty, please call us here at the office at 865-689-5003. If you are leasing the Quadriciser, you will want to fold up the shipping crate and store it until you are ready to return the Quadriciser. Cut the tape on the large outer shell. The shell will now be in 2 pieces. Fold the pieces and stack inside the base of the box. Place the box top over the base. Move the box to your storage location, along with the pallet until you need to return it.
And the experience that I've had with the Quadriciser has yielded a lot of positive results in my interaction with it and with patients. I found over the past 10 years that there really did not exist particular and specific pieces of equipment that would work the various ranges of motion, the functional movements that the Quadriciser does, particularly with the specific patient population that we tend to incorporate. Whether you've had spinal cord injuries, neurologic damage, whether it be from a stroke or some other debilitating illness, the Quadriciser fills a needed and valuable gap in the system as far as therapy with relation to what it's able to do. Many physical therapists, particularly maybe in the orthopedic setting, the outpatient setting, obviously have at their disposal equipment such as stationary bikes, treadmills, elliptical exercises machines, various weight equipment. Well, when you go into the inpatient setting where you're going to have whether it be subacute units in the hospital, skilled nursing, anywhere that patients are going to be treated and may or may not have the various functional abilities that someone, say in the outpatient setting, whether it be orthopedic related or whatnot, have, the Quadriciser is an excellent tool, a perfect adjunct in the treatment plan. And when we're looking at patients, whether they're being treated on a treatment table or on the plinth there in the gym, in the parallel bars, you really should see this machine being used full-time right alongside the different modalities of treatment. You can use it in various manners, whether it being adjustments for reclining the upper trunk or torso, variations in the allowable range of motion in the hip, knee, ankle, or upper extremities. The Quadriciser can be adjusted to ensure adequate and safe ranges of motion. As far as in the course of a given day where you're involved in various activities, whether it be patient-related hands-on treatment, clinical documentation, returning phone calls, the Quadriciser enables you to have a piece of equipment that can function pretty much independently as hands-on attention once proper settings and adjustments are made. One thing to consider, once you see the machine in use with the patient doing the actual exercise, you'll notice that the durations of treatment, whether it be 10 minutes, 20 minutes, 30 minutes, those durations are something that I dare say a physical therapist in a busy environment is not going to be able to perform, at least for that amount of time, whether it be just from the simple time constraints or even the physical endurance that it would require to perform these motions. So once again, the Quadriciser adds a valuable adjunct to the treatment plan with your patients. many of the folks that are using this, for lack of a better word, they do have somewhat of a lack of hope, and they're able to actually use a machine independently of someone assisting them or taking them through ranges of motion exercises that they've typically been in more of a dependent role. And so the joy and just the sense of accomplishment that the patient experiences on the Quadriciser is something that, once again, really doesn't exist in many other pieces of equipment. Not only is it a machine that engages hope for many folks who may have not had much hope, or at least as you work with them in the clinic as it relates to particular pieces of equipment or exercises, but it's almost a very relaxing experience for the patient once they are properly set up and the machine begins to take them through the ranges of motion. In some cases where you're working with patients, whether it be manual therapy, passive range of motion, various techniques, whether it be PNF or what have you, you may experience just some initial spastic reactions from patients where sometimes just the simple manual contact may elicit that. With the Quadriciser over time and use with the various positioning changes you can make, in many cases you can avoid some of the spastic responses that may be encountered just with some of the other forms of exercise. As far as the actual machine usage itself, questions may come up: is it a passive device? Is it an active assisted device? Is there any degree of resistance? And the answer to that is really all the above. You can use the machine where it actually just engages its own passive principles, where true passive range of motion may be all that's incorporated. Then there's active assistive, and even there is a degree of active and active resisted when you incorporate the use of the bungee cords and the systems that the pulleys enable you to do. In many cases you may actually experience where a patient that may, say, have some spasticity or just inherent resistance to manual contact or repetitive range of motion, actually over time and with use of the machine has a more positive response than you may have experienced in the past. Simulated walking. It mimics the natural gait pattern of human movement. By reclining the seat back, paying attention to your own body mechanics, the patient is positioned in an effort to mimic the normal gait pattern. The speed should result in a smooth and consistent range of motion in the upper and lower extremities. Noticing that the arms moving in opposition in one another from flexion to extension, as well as the lower extremities. To increase a weight-bearing force to the lower extremities, instruct the patient to keep the knees extended. Then slowly move the seat forward, producing an increased force on the plantar surface of the foot, resulting in increased weight bearing and increased dorsiflexion range of motion.